As they struggle to stop the spread of COVID-19 across Greater Sydney, New South Wales health officials are scrambling to get on top of outbreaks in the regions where the situation is on a knife's edge. The state's far and far west are of concern, including the predominantly Indigenous community of Wilcannia, where dozens of residents have tested positive. Today, the far west of the state had 40 new infections, with 25 of those in Dubbo alone. Dr David Gillespie is the Minister for Regional Health. Before he entered federal parliament in 2013, he worked for 2 decades as a gastroenterologist and consultant physician, spending most of that time on the ground in regional New South Wales. He knows this patch. He spoke today about the current challenges of providing health in the regions, and he joins me now from Canberra. David Gillespie, thank you very much for your time.
Hi, Chris.
These clusters...
My pleasure to be with you, Chris.
Yeah, it's good to have you with us. These clusters in Western New South Wales, and I should mention also in Victoria's Goulburn Valley, they are an extreme worry, aren't they?
They are a concern, but we have got so many extra resources in there, both the state system with the hubs in Walgett and in Dubbo, the extra drive-through clinics. We've got the Royal Flying Doctor Service that's been active for weeks, bringing in extra supplies. We've got extra GPs, another 5,800 doses across existing and expanded GP clinics. We have got pharmacies being engaged, and we've got Australian medical assistant teams that normally go off in disasters overseas. We've deployed 4 of those in those very areas you mentioned, and we also have ADF medical teams, 5 of them. So we've got a full court press happening along the Darling, all those Darling River towns and remote towns. They're all being covered as quickly as possible. Some of them have already had people in place, and expanding over 3,000 vaccines in those little small towns that are the ones you've mentioned.
But we've still got a number of COVID positive cases. I just wonder, what have you been told by those on the ground? Can we expect, for instance, a death toll to emerge from the Indigenous community?
Hope not. Some of the people are obviously very young, and as we know, the hospitalisation rate of younger people is much less than elderly, but some of them will have comorbidities, because we know that demographic do have a lot of diabetes and kidney diseases that make them extremely vulnerable. This was always our fear. Both the state health system, the Aboriginal community controlled health organisations, the general practices that were offering vaccines, this was their worst scenario.
Well, why didn't we vaccinate more of these people in those communities?
Well, look, there has been vaccines available in general practices and in community control long before this broke out. But there has been a problem with a general vaccine hesitancy around Australia, but it's been very evident, according to the people I've spoken in Dubbo. And I did work in Dubbo for 3 or 4 months some years ago, and in Origin, all those areas, and I was running down the Darling last year. I know these towns, there's not a lot of infrastructure in them. There's a lot of crowded housing in some of these small villages. It's just a perfect scenario. And the thing that's changed is the incredible infectivity of the Delta variant.
Yeah.
But as I said, there's a full court press happening there now, and we will get it under control. But obviously some people are going to, just by sheer statistics, going to be sick.
You spoke about digital health on a major webinar today. It is a little bit of a two-edged sword, this, isn't it? It's been a revolution during a pandemic, but potentially it's very superficial technology. Well,
look, it's not the same as having your healthcare professional in front of you and a face-to-face consultation. But if you've got video consultation, it is pretty good for following up. It saves travelling many hundreds of miles or thousands of miles in some cases for follow-up after operations or chronic conditions that just need fine-tuning. So digital technology is rolling out around most general practices and healthcare centres to enable it. Look, a telephone consultation, if you're well known with your GP, you can sort a lot out. But like I said, video consultation's even better, but it doesn't replace it. But it's being supported. There are Medicare items for it all.
The trick is, of course, to make sure that people have their own private, hardware, which some in far west communities don't. And the other thing is you've got to make sure you've got good internet connection, which is not always reliable in the bush.
You're exactly right there, Chris. We spoke about that today. There's three parts to this. You've got to have a patient that's happy to use it and the capability to do it, the doctor who's got all the equipment, and you've got to have technology that works.
Yeah.
Now, there is satellite coverage in these remote areas, and all the state hospitals have a digital capability, and most general practices do too. But again, it's getting used to it and utilising it.
Yeah. Dr. Gillespie, thank you very much for your time tonight.
My pleasure, Chris. Anytime.